Hi, this is Dr. Eric Ruderman coming to you from the Rheumatology Winter Clinical Symposium here in Hawaii. And we had some very interesting presentations this week. One of the things we discussed was medical marijuana and what it means to the rheumatologist. I had a chance to participate in a point-counterpoint with Alvin Wells on this topic, and we looked at the issue from a lot of sides. It puts physicians in an interesting clinical place. Medical marijuana has now been approved for use in 25 states and in the District of Columbia, but it's still against federal law. It's still considered Class 1 by the DEA, and it's still against federal law to prescribe it or dispense it, which means it has to go through medical dispensaries and not through the usual pharmacy network and not through a prescription from a physician. From a rheumatology perspective, patients are interested in marijuana primarily for pain relief, but also potentially to treat their various diseases. And we looked at that very carefully, and it's quite interesting. There frankly is no data. There's no data on any of the rheumatologic conditions in terms of marijuana treating the disease process itself. There is some data on the use of marijuana for pain, but not specifically in our diseases. There's a lot of interesting data on the components of marijuana, the various chemical compounds, and how they may be useful for various pain syndromes. But at the end of the day, the decision to recommend or at least discuss marijuana with your patients really comes down to an issue of thinking it might help, but without any data to back it up. And that's a challenge for physicians, and I think one that hopefully in the coming years may be answered by some research that actually looks at this issue more carefully. We'll have to wait and see.